Adrenomyeloneuropathy, AMN, affects both men and women carriers and progresses over 5 to 20 years, but does not limit lifespan. Regardless of diagnosis, our goal is to maintain your quality of life by first making you aware of common symptoms and getting you the help you need. Here are common symptoms adults face. A key AMN problem is difficulty with walking, also known as gait dysfunction. This is because people have sensory changes, stiffness, and weakness that all contribute to instability and decreased walking speed. These are due to impaired nerve conduction. AMN patients experience various degrees of pain, from heaviness in the legs, a feeling of legs of lead, to back pain and shoulder and neck pain, from walking so cautiously and tensely all the time. In some people, the legs and trunk get stiffer to compensate for the instability, and the knees become rigid and locked. People have described a sudden brief inability to continue moving freely or freezing. Individuals with AMN may find it difficult to navigate narrow passages, turning around and dual tasking like walking and talking, or walking while carrying an object, as they are challenged to handle navigation and balance perturbations. Individuals with AMN are at risk for falling because they are unable to self-correct after stumbling or tripping. Many individuals with AMN report that stiff gait and urinary urgency compound each other. Moving can be even more difficult, as it is for most people with environmental, social circumstances such as when you are unwell, feel cold, walk in the dark, or drink alcohol. More specifically, individuals with AMN experience sensory loss, possibly because their proprioception is impaired. Proprioception is the ability to know where your body is in space. This contributes to single leg stance balance issues. A possible secondary complication is pain at the knee or foot due to spasticity, as in misalignment for the kneecap or limitations in the ankle. Some individuals with AMN struggle with hip flexion to lift their legs, and not being able to lift their leg when walking, managing at best a shuffling gait. Exercise is very beneficial for AMN patients, as long as it does not create a risk of injury by falling. Swimming and cycling are two excellent choices for general cardiovascular fitness, but be sure to consult a certified physical therapist. Gentle exercise can help alleviate pain. The physical therapist will address areas of impaired mobility and alignment, including 1. Proper body alignment, 2. Balance and strengthening programs, 3. Use of appropriate devices to help with balance and good orthopedic alignment. Weakness is best addressed by strengthening muscles specific to the person's limitations and addressing each major muscle group of the lower extremity, particularly at the hips. Stretching is very important to maintain full range of motion, particularly in muscles with an increase in muscle tone, such as the Achilles tendon, hamstring, and hip flexor. Your physical therapist may be able to make adjustments visually by having you exercise using a mirror or at night turning on the light to give the brain and body more sensory information to make the necessary adjustments. Or by practicing balance and walking training using light touch of one's hand or fingers to allow the proprioceptive information that is not being relayed fast enough through the legs to be processed through the arm. Usually the light touch becomes less necessary with practice, but is good at least for making initial training more successful. For the lower extremity problems, your physical therapist may recommend some equipment, such as orthotics for your shoes, which have good arch support, or a patellar tracking knee brace that keeps the knee aligned. Walking devices might also be helpful, as in a cane or rolling walker, grocery carts or strollers. Anything necessary to keep you actively moving in your environment.
Hello, I'm Ben Lanai. I live in Palo Alto, California, and I have adrenomyeloneuropathy, or AMN. I'm in my late 40s now, was diagnosed in my mid-40s, and I strongly believe that my exercise regimen, including physical therapy and Pilates, has allowed me to stay healthy and strong and do the things I like to do, such as walking my dog.
Hello, my name is Isaac Morris. I'm a personal trainer at V Fitness in Palo Alto, California. The exercises we're about to go through with my client Ben are good for people with adrenomyeloneuropathy because they focus on sustained tension and allow for a good focus on form and minimize risk. We'll begin with a series with resistance bands.
Here we begin by working through a series of upper body exercises. Though the primary movement is upper body, by maintaining alignment and keeping the muscles engaged to hold form, we are passively working on the trunk and lower body as well. Our first exercise is the bicep curl. He begins by extending the arms forward from the shoulders without releasing the shoulders, and slowly curling up from the elbows, fighting the tension as he extends back out. To decrease the tension, stand closer to the band's point of origin, or lower the elbows slightly. By adding pauses as shown, you can dramatically increase the workload, but allow for continued concentration on the form and muscle control in the rest of the body. For the first set, we are doing each exercise as an isometric to properly and effectively activate the muscles. The following sets will be performed as standard repetitions. To start, ground the feet properly. Maintain a slight bend at the knees to prevent locking or hyperextension. Engage the quads, glutes, and trunk muscles, and keep them activated through the entire exercise to hold the proper form. Our second exercise is a modification of a tricep extension. Simply lower the elbows and press the hands down to extend the arms fully. The extension should come from the elbows, not from the shoulders, to keep the work in the triceps rather than the anterior deltoids and the traps. This form will be maintained through our series of upper body exercises. Our next exercise is the standing row. Maintaining the same posture as from the bicep curls and the tricep extensions, simply drive backwards through the elbows, pulling with the muscles of the upper back. Release forward from the shoulders without releasing the shoulders. Our final upper body exercise is trunk torque. Maintaining the exact same form as before, simply turn to the side. Start with the hands in by the sternum. Slowly extend the hands forward until the torque of the band is felt in the obliques. Our next series focuses in on the lower body. Each of these exercises can not only be done from standing, but can also be done lying down on a mat. The first exercise that we begin with is the hip flexor raise. While standing, simply raise through the knee, pulling from the muscles of the hip flexors. The trainer can then add additional resistance by pressing down on the top of the knee. Perform several isometric holds and then repeat on the other side. We then move on to standing adduction. Shift the weight to the support leg and press out through the edge of the opposite foot. Again, additional resistance can be added by simply pressing into the side of the foot. The next exercise are hamstring curls. Keeping the knee of the working leg behind the knee of the support leg, slowly pull up through the heel. Lastly, we move on to outer hip rotation. As with the hip flexor raise, pull up through the knee. Then, by engaging the glute medius and minimus, rotate the leg to the outside. Our final set focuses in on the core muscles. This trunk strength series is a progression using a Swiss ball. For the first and most basic form, start by lying on the mat in a sit-up position. Relax the entire upper body to the mat, including head, neck, and shoulders. Then draw the belly button in towards the spine and press the lower back into the mat. Position the Swiss ball against the top of the knees, and with the arms extended from the shoulders, press into the ball. All of the tension should be coming from the abdominal muscles and the hip flexors. The next modification in this progression is accomplished by simply elevating the feet and extending them straight out from the knees. It is important not to press down too hard from the hands to avoid losing the hip placement and control of the lower back. For the final progression, while one side squeezes between the knee and the hand, the other side extends the arm out and the leg out, then brings them back together to tap the ball. This is done in repetitions.
Hi, I'm Heidi Wentworth and I work here at V Fitness Center in downtown Palo Alto. I've been in the fitness industry for 20 plus years and I'm about to explain what Pilates can do for people that have AMN. Pilates is a fitness discipline that was started by Joseph Pilates in the 20th century. It emphasizes core strength, endurance, flexibility, and movement control. In this particular exercise, we like to begin by lengthening and stretching the calves, Achilles tendon, and hamstrings. And here he's working through the ankles, dropping the heels down to get as much range of motion as possible. This one I have him bending over so that he gets a little bit more of a stretch through his lumbar spine. So he's working the whole backside from his lumbar spine through his glutes, his hamstrings, and his calves, including the feet. And we further the stretching on the chair through his IT band and his hips. This allows him to sit comfortably while working through the range of motion. And he does about anywhere from 8 to 10 repetitions per exercise. Now we're moving on to the reformer to start footwork. And he here is lying in a horizontal position. We're looking for a neutral spine as he's working through all the areas of his foot, starting at the ball of the foot, moving through the arch, and then through the heel in a parallel position. And I'm walking around to see that he's maintaining a neutral spine as he's working the different areas of his feet. I'm looking for lengthening here and that he's staying focused as he's moving through using his breath, exhaling on exertion. Now he's moving his feet into second position and then first position, working his hips outward and then working his hips inward as he's moving back. And again, each exercise is about 10 repetitions. He's working the entire body here. Although it seems he's using his legs, he's also working the core and keeping it active throughout the exercise in the series. And after we're done with the foot series, we move into the calf, allowing him to lower his heels, creating flexion through the ankles, Achilles, and his hips here. He's rolling out his fascia as he's finishing. And then we move him right into foot strap series. And again, he works on all different planes here, allowing flexion through the knees, the hips, and the thighs, maintaining a neutral spine, keeping his tailbone stabilized as he works through the hips, using length and rotation in each direction. And this series requires about 8 repetitions in a medium tension. We're adding a straddle series here for his inner thighs as he moves right back into the series to finish up. And he finishes with a hip flexor hold here for about 30 seconds. And then we're going to move into the upper body, doing the arm series, as he is again looking for a neutral spine as he holds his legs in 90-degree position, maintaining the neutral, and the ball is used for feedback so that he works through the pelvic floor as he's working the tension through his upper body. And this is quite difficult exercise, but he's doing a wonderful job here. I'm making subtle corrections as he's moving through the series. And we like to end the session with a lunge, and this allows him to open up even deeper through the hips, hip flexors, hamstrings, stacking the spine, and allowing his range of motion wherever that may be for him at the moment. I keep encouraging him here to move back and challenge his range of motion. In this exercise, you see he's using the yoga block for assistance, as he cannot place his hand, he's unable to place his hand all the way down, but we use props whenever needed to help him move through his exercise correctly. I'm assisting him here so that he gets a sense of where he needs to be moving through the exercise.